Regenerative medicine, often referred to as stem cell therapy, is one of the fastest growing areas of healthcare. Regenerative medicine holds the hope of helping people with conditions and diseases at one time thought impossible. We believe that regenerative medicine will be an important part of the healthcare of tomorrow. Stem cells play a big role in your body. They're what helped your body grow and develop. They're what fixed you every time you had a bump, a scrape, or an injury. Stem cells also help you maintain your body by replacing cells and other things as they naturally die. As we get older, we have less stem cells because we use them up. Stem cells also slow down with age and cannot replace themselves as fast as they could when we were younger. At some point, our bodies can't keep up with the demand of maintaining itself and fixing things that become damaged from overuse or injuries. This is when we get that chronic or degenerating condition that can't be fixed. What we do with regenerative medicine is simply add more stem cells directly to where they are needed. They then do what they do naturally and help your body heal. If you're watching this video, either you or someone important to you is suffering from knee pain, a serious, debilitating problem affecting millions of people. Knee pain is a very common condition that affects people of all ages. Knee problems may arise from injuries, such as torn cartilage or a ruptured ligament. These problems can be from the wear and tear of life and can lead to painful arthritis. Osteoarthritis is one of the most common types of knee pain. With osteoarthritis, the cartilage in the knee joint gradually wears down. As the cartilage wears away, it can become frayed, broken, rough, and the protective space between bones then decreases. In its final phase, it can become so deteriorated that it becomes what is called bone-on-bone. This is when there is no protective space left, which can produce painful bone spurs, extreme pain, and loss of the use of the knee. The problem with knee pain is that we need our knees to live our lives. We need them to work, play, and enjoy the freedom of movement. When most people are suffering with knee pain, they usually use pain relievers to lower the pain so that they can function at work, at home, or enjoy their hobbies. The problem with this is that pain is one of the ways our bodies let us know that something is not right, that something is broken or compromised. When we take something that lowers our pain or masks it, we are then able to use that part of our body. But if we use an injured or compromised body part, it usually becomes worse. It can sometimes get so damaged that it is beyond repair. Regenerative medicine offers more hope and promise than anything else out today. It does this by helping the body repair what is broken or damaged. If what was broken or damaged is fixed, then the pain will go away and normal function or use of the knee can return. Regenerative medicine has proven to be very effective in helping people get rid of their problems and get back to living their lives.
Hi everyone, it's Lana at New You Regenerative Medicine over at Back in Line Chiropractic Centers in Plantation. And I am here with one of our patients, the famous Jused Millian. Jused is known to have broken the powerlifting state record in Florida in her age group for both the back squat and the deadlift. Jused loves to compete in CrossFit. And I'm gonna let Jused take it from here to tell us about who she is and her experience here with us.
Hi guys, like Lana mentioned earlier, my name is Jused Millian. I've done some powerlifting competitions, CrossFit, and I've also played for the Florida Grid League. And I was actually having some knee issues. I've been having knee issues for an extremely long time and tried like a whole bunch of different things and decided that I finally needed something a little bit different. But I didn't. I was told that I was probably going to need surgery eventually, but I decided to go ahead and try to find other alternatives, and that's how I came here to Back in Line and found Dr. Robert and Lana and had one of my first treatments.
Yes. Tell us a little bit more. You said it the left knee that we did the regenerative cellular therapy injection on?
Yeah, so it was my left knee and I had my first treatment about 7 weeks ago, sorry. And one of my concerns about it was like the downtime. Like I was like, okay, I was gonna have a competition in like 4 or 5 weeks after that, so I was really concerned about not being able to do it, but they made me feel really comfortable, and within like 2 weeks I was almost back to 100% of what I was doing before, minus the pain, which was outstanding. Like obviously that was the first complaint that I had when I came in here, because I'm training for all these sports and then it's enabling me to do or perform how it is that I need to perform at that level.
Great. So on a scale from 1 to 10, the pain that you were feeling in your knee prior to doing the treatment to now, 10 being the worst, tell me where you were and where you are now after 7 weeks.
Okay, so when I was actively training, my pain will go anywhere between 7 to 9, 9 being like really bad. Like I just couldn't train. I had to like ice and take a couple of days off, which obviously everybody, you know, knows that when you're in training, like some sort of performance training for a competition or something, like the 2-3 weeks before competition are very critical, right? So a lot of times I couldn't do some of the movements that I had to do or train for those movements. So like I mentioned earlier, I played for the Florida Grid League, and they might have required me to do pistols, and I couldn't do pistols with that leg because of the amount of pain that I was having. And now I'm able to do them with like absolutely like no pain. So now I'm just working on getting my knee. Obviously when you're off your knee, you're babysitting it because of the pain. Your knee probably tends to get a little bit weaker. So now I'm just working on making it stronger. But the process has been so quick because I don't have that pain. So I don't have to now take 2 or 3 days off between each training session to give my knee a break. So it's outstanding.
Great, thank you. And today Gisette is actually about to do her second treatment, which is part of her protocol. And how are you feeling about it? How'd you do with the first one? How did you feel?
So
when
it was
getting
outstanding.
treated?
So I babysat it because I think that's like a little bit natural for us to do, you know, especially after a treatment. You tend to like babysit it because I don't want to go back to like lifting extremely heavy so quickly. And then, you know, it was recommended, you know, 2 to 3 weeks, just try to stay off of it, nothing too crazy. And now I'm like pretty much back to my old numbers, which is outstanding, and just looking forward to what my next treatment is going to do, which I can't even imagine it getting better because it's already like amazing.
Awesome.
But I'm extremely excited to get back to you guys and do another video and tell you how amazing it feels.
Awesome.
And then I'm going to want to just do the other knee, even though it doesn't hurt that much, but it's going to be great.
Awesome. Thank you so much, Gisette. We love you.
Thank you.
Have a blessed day.
Thank you, everyone. Bye.
Bye.
Nobody deserves to suffer from chronic debilitating pain. My name is Dr. Adam Weitzman. I'm a board-certified pain management physician practicing in Southern California. Pain can be debilitating, and it can often form a cycle that reinforces itself. And the treatments that we would employ to get better might exacerbate the problem. Steroid injections might be a good option if there's a lot of inflammation to reduce, but often the pain will come back. When steroid injections don't work or cause side effects, patients are often looking surgery in the eye, and surgery is sometimes a gamble, and once it's done, it's permanent. My favorite thing about being a pain management physician is trying to get patients more functional again through minimally invasive techniques and avoid surgery. And now I have a new regenerative medicine therapy that can help accomplish that. Restore is a new regenerative medicine product designed to encourage the body to heal its own damaged tissue from within. It contains growth factors that may give the body an opportunity to heal itself from the inside. Patients who come to me for a Restore injection typically have tried everything before this. They've tried steroid injections, they've tried medications, they've had side effects to these treatments, and nothing seems to be working. Restore provides another option for them, allowing the body's natural healing powers through the use of added growth factors to heal its own damaged tissue, which is something we haven't seen before. The important thing about tissue regeneration is that it might allow more functionality in a natural way. There's a promising future for regenerative medicine, and I'm very proud to be at the forefront of that.
If you're watching this video, you're probably among millions of people who needlessly suffer from knee pain, elbow pain, foot pain, shoulder pain, peripheral neuropathy, joint pain from arthritis, and many other conditions. Unfortunately, those who suffer from these problems have had virtually no options to relieve or fix these issues. Many people try over-the-counter pain relievers and expensive prescription medicines that do not fix the problem and may only offer some temporary relief with sometimes devastating side effects. Some people are recommended surgeries that are risky, expensive, painful, and may or may not fix the issue. Even worse, some are told by their doctors there is nothing that can be done and are left to suffer every day without any good options. The good news is, there is a growing field in healthcare called regenerative medicine. Regenerative medicine has already been responsible for helping hundreds of thousands of patients with these types of conditions while preventing countless numbers of surgeries. Regenerative medicine is the rapidly advancing area of medicine that has the ability in many cases to help repair injured and damaged tissue in the body that was not possible before. The types of regenerative medicine used in this office are regenerative tissue such as umbilical cord tissue, umbilical cord blood, amniotic fluid, and amniotic membrane. These types of regenerative tissues are a next-generation, non-surgical, minimally invasive treatment that uses the human body's own ability to heal, repair, and regrow tissue. Regenerative medicine brings hope and possibilities that were not available before. That's right, finally, there is hope to actually fix your problem. We do this by using the healing and growth components along with mesenchymal stem cells that helped you develop and heal from when you were born until fully matured. These same components that helped you develop, grow, and heal are found in the regenerative tissues we use. Mesenchymal stem cells are your body's master cells. The reason why they are sometimes called master cells is because mesenchymal stem cells are multipotent. What multipotent means is that these types of stem cells can develop into more than one cell type. So if you have a joint problem, they can become joint cells and fix your joint. If you have a tendon problem, they can become tendon cells and fix your tendon, as well as cartilage, muscle, ligament, or other types of cells needed to fix your area of pain or injury. One of the reasons your body may not be repairing itself is, as we age, the number of mesenchymal stem cells in our body decreases. When we are born, we have around one of these mesenchymal stem cells for every 10,000 cells. As we get older, the percentage of mesenchymal stem cells to other cells decreases. As percentages decrease, it gets harder and harder for your body to repair itself. It is harder because mesenchymal stem cells are what help our body repair injuries. If we have less mesenchymal stem cells, then we have less healing potential. This may be why your body does not heal or respond to treatments the way it did when you were younger. When you get to be age 50, your ratio could be as low as 400,000 cells to every one mesenchymal stem cell. That is a 40-to-1 decrease, meaning your body has 40 times less healing potential as it did when you were born. At age 80, it could be 2 million cells to every one mesenchymal stem cell. That means 200 times less healing potential than when you were born. The procedure is simple. Our medical professional will inject the regenerative tissues right into your area of pain or injury. The mesenchymal stem cells, as well as the other healing and growth factors injected, are as powerful and concentrated as they were when you were a child. This helps give you back the healing and repair power of your youth. Stop suffering. Be able to do things you have not done in years. Live again with little or no pain. There's now a better option. Thank you for watching this video. If you or someone you know are tired of dealing with pain or other problems that these regenerative tissues may help and would like to find a solution, we are happy to offer you a free consultation to see if it might be right for you.
Hi everyone, it's Lana over at New You Regenerative Medicine at Back in Line Chiropractic Centers, and I am here with our beloved Giselle Dorset. Giselle has been a patient here at the office for many years, and she's here to talk to us a bit about her experience with regenerative medicine. So Giselle, I'll start by asking you about how you found out about regenerative medicine.
Well, I've been coming to Back in Line off and on for years. I was a very committed patient until my scheduling kind of kept me away, but I always trusted what I was receiving here. We had a great relationship, and I really enjoyed Dr. Peter and his care and his expertise, and his wife Barbara, also wonderful doctors.
Thank you.
And about what brought me here, we had still had communication, so they had my contact information, and I remember receiving a text about some new programs that were going on, and I was very excited when I learned that it would be involving things that what was going on with me at the time. Regeneration was something I was very interested in.
Yes, so you had been a patient for quite a few years,
Mm-hmm.
and then you had to stop because of your schedule,
Mm-hmm.
and then due to an injury that you had, You were experiencing some pretty severe pain in your, was it left or right ankle?
It was my left ankle.
Okay, you want to tell us a little bit about that problem and how long you suffered with it?
Yes. I was very lucky to be able to go on a mission trip for 6 months, and it was on the other side of the world. So I was in different places. I was in Nepal, Australia, the Philippines. I did a lot of traveling. And in Nepal, I was in the foothills of the Himalayas, and I rolled my ankle. And at the time, it felt bad, but I thought it was going to go away and get better. That was back in 2016, and it wasn't getting better when I got back home, and it continued to get worse. And I tried to ice it or put heat on it or do something homeopathic, because I wasn't into using medicines or pain relievers for it. And still, there would be times when the pain would spike and it would be horrendous. But
and so how was that, I'm sorry that happened to you. And how is it affecting you 5 years after the injury? How is it affecting you at home with your home life?
I was doing less. I worked long hours, which was hard because I'm always walking and standing, but I just wanted to rest and not do anything. So it was affecting me.
Yeah. Was it affecting you? Or also, is it true that you were doing some beginner ballet classes and exercising?
Yes, I had just gotten into that, and I was really enjoying it because I always wanted to get more active and do booty bar and dance and just be active. And that was not happening anymore because of the injury.
Wow. And what other things did you try before regenerative medicine that did not work?
Well, since I wasn't using medicine, that was not something I wanted to do, but just icing it and keeping it comfortable, moving as little as possible, and or putting heat on it, just not moving.
And that would only provide a temporary fix, correct?
Very temporary, yeah.
Okay. Okay, so let's talk a little bit about the aftermath. It's been 3 months now, right?
You're going on our
Since
third
your-
month. Mm-hmm.
Okay. Since your treatment, and I've been meeting you here, and you've been doing really good, I see.
Yes,
And
wonderful.
tell us a little bit about how has getting the care changed your life?
Well, I was doing a very active activity last week, and normally I would feel a spiking pain, and it would be very noticeable, and I didn't notice any pain. I didn't notice that I didn't notice, and a few days after that, I realized that I was doing some extra activities, and I wasn't feeling any pain at all.
Wow.
Normally, I would expect with any procedure that you would have a little bit of residual pain or something, but I had no pain. And I had to keep checking myself during the day to see if I had any pain, and if it was just in my head, but I had no pain, and I didn't notice for like over a week that I didn't have any pain after some time after recovering from the procedure.
That's awesome. Great news. Giselle, on a pain scale of 1 to 10, 10 being the worst, the most excruciating pain, please tell us where you were from 1 to 10 prior to treatment and where you are now.
Prior to treatment, it would be around an 8 and 9 normally, and spike at a 10, moving toward 11 when I'm standing or being jerked in a certain direction. But now it's 0.
Wow. That's pretty amazing.
It is definitely.
I'm curious to know, how soon did it go from an 8 to 10 all the way down to a 0? You just had amazing results, so I'm curious.
It took about a month and a half before I went down to about a 6. And then I didn't even notice after the 6 when it got down to 0. So I'm not even sure when I hit 0 exactly, but I noticed last week I had no pain. And I probably didn't have pain 2 weeks ago, but I just forgot about it. Forgot that I had pain.
That's amazing. Congratulations.
Thank you.
And just one last question. What would you say to someone who's considering getting regenerative medicine done?
Well, if you are looking at a lot of other options, and I know that for me, if I didn't get anything done, that surgery was going to be an option at some point. I'm glad I was able to get away from that option, but I would look into this first, because what do you have to lose but pain and discomfort and worry and stress, and just so much more you can gain. So I would definitely look into this.
Awesome. Thank you so much, Giselle.
Thank you.
We're so happy for you. Take care, guys.
If you're watching this video, either you or someone important to you is suffering from hip pain, a serious debilitating problem for millions of people. Hip pain is a very common condition that affects people of all ages. Hip problems may arise from injuries such as ligaments, tendons, muscles, or other soft tissues around the hip. Hip problems can also be from the wear and tear of life that can lead to painful arthritis or bursitis. Osteoarthritis is one of the most common types of hip pain. With osteoarthritis, the cartilage in the hip joint gradually wears down. As the cartilage wears away, it can become frayed, broken, rough, and the protective space between the bones then decreases. In its final phase, it can become so deteriorated that it becomes what's called bone-on-bone. This is when there's no protective space left, which can produce painful bone spurs, extreme pain, and makes it hard to get comfortable or even walk. The problem with hip pain is that we need our hips to live our lives. We need them to work, play, and enjoy the freedom of movement. When most people are suffering with hip pain, they usually use pain relievers to lower the pain so that they can function at work, at home, or enjoy their hobbies. The problem with this is that pain is one of the ways our bodies let us know that something is not right, that something is broken or compromised. When we take something that lowers our pain or masks it, we are then able to use that part of our body. But if we used an injured or compromised body part, it usually becomes worse. It can sometimes get so damaged that it's beyond repair. Regenerative medicine offers more hope and promise than anything else out today. It does this by helping the body repair what is broken or damaged. If what was broken or damaged is fixed, then the pain will go away and normal function or use of the hip can return. Regenerative medicine has proven to be very effective in helping many people get rid of the problem and get back to living their lives. If you're watching this video, either you or someone important to you is suffering from shoulder pain, a serious, debilitating problem for hundreds of thousands, if not millions of people. Shoulder pain is a very common condition that affects people of all ages. Shoulder problems may arise from injuries, such as a rotator cuff tear, frozen shoulder, bursitis, or torn cartilage. These problems can be from the wear and tear of life that can lead to painful arthritis. Osteoarthritis is one of the most common types of shoulder pain. With osteoarthritis, the cartilage in the shoulder joint gradually wears down. As the cartilage wears away, it can become frayed, broken, rough, and the protective space between the bones then decreases. In its final phase, it can become so deteriorated that it becomes what is called bone-on-bone. This is when there is no protective space left, which can produce painful bone spurs, extreme pain, and the loss of the use of the shoulder. The problem with shoulder pain is that we need our shoulders to live our lives. We need them to work, play, and enjoy the freedom of movement. When most people are suffering with shoulder pain, they usually use pain relievers to lower the pain so that they can function at work, at home, or enjoy their hobbies. The problem with this is that pain is one of the ways our bodies let us know that something is not right, that something is broken or compromised. When we take something that lowers our pain or masks it, we are then able to use that part of our body. But if we use an injured or compromised body part, it usually becomes worse. It can sometimes get so damaged that it's beyond repair. Regenerative medicine offers more hope and promise than anything else out today. It does this by helping the body repair what is broken or damaged. If what was broken or damaged is fixed, then the pain will go away, and normal function or use of the shoulder can return. Regenerative medicine has proven to be very effective in helping many people get rid of their problem and get back to living their lives.
Well, my name is Elizabeth. I am a patient of Dr. Peters. Actually, through him, I got to meet Lana and Dr. Robert. And what happened was my knee's pretty much been bad. I was in a car accident 3 years ago. And I came to Dr. Peter because I was suffering horrible, everything from backs to down to my toes. I was feeling better in one part, but my knees were still causing me pain. So I was still limping a lot of times. I couldn't walk. I wasn't doing the things I wanted to do, like walk, even simple as walking my dog or backpacking or hiking. So in November of last year, 2020, Dr. Peter has suggested that I meet Dr. Robert and see if it would be something I can work. So I went and met up. I asked about it, was curious, talked about it with my partner, and we thought maybe it would be a good investment for it to see. At least so that I see if my quality of life would get better. I work all day with kids, so end of the day I'd be limping, just tired, can't do much. So I did in December, then in February, but even by January, after the first treatment, I was noticing a difference, that I wasn't limping as much, I was moving more, and my partner had said I wasn't complaining at all. Like, he realized I suddenly had more energy and I was able to move around a little bit more. And then after February, even by March, like end of March, I was walking. I started walking normally and it was amazing. And I started being able to move around on my job faster too, even when the kids were noticing. And so they were looking at me like, Miss Liz, you're so fast now. And I was like, oh, thank you, I guess. But the main part was I'm actually able to move, and the idea of maybe hiking again, backpacking, or even as simple as me going in my backyard and throwing and playing catch or fetch with my dog is possible, and I'm doing so. And I hopefully continue to see treatments. I mean, I'm still healing and doing everything. I even lost weight from my car accident and that part. So even once I started the treatment, I actually went down 15 pounds. And that is amazing. And it's never happened after the car accident because I was able to move. So the main part was that I'm able to, this quality of life has improved. One of those things that were good was I had to get adjusted every week before the treatment. Sometimes I would come in twice a week, and every time Dr. Peter had to adjust my knees. And sometimes I had to come in a third time because my knees went out from something as simple as going up the stairs or down the stairs. But then after the treatment, even the first treatment, I didn't have a problem. My knees I didn't need to get adjusted. And even after the second one, it only got better. In fact, I got in December, and he only had to adjust me once since then. And we're coming in April now. Just showing another testament of how wonderful this treatment has been for my knees and my body in general.
Hi, my name's Catherine Fannin. I'm a patient with New You Regenerative Medicine. I have been coming for treatments for about 2 months, and I had suffered with a frozen right shoulder and lack of mobility for over a year. I didn't think it affected my life very much until I came for a consultation, and Dr. Lutz asked me what areas does it affect me the most? And I said, well, when I sleep, that's the only time. And he said, well, you have to sleep every day. And I realized how much it was truly affecting my life. I was not sleeping through the night. I would wake up with severe pain. I would have to sleep in certain positions, which was causing other areas of my body to ache. I decided to take a leap of faith. I had tried many things, cortisone shots, physical therapy, I had considered surgery and did not want to cut my body open and be on medication for a lengthy period of time. So I tried regenerative medicine. After coming here now for 2 months, I am able to use my arm. Like before I ever had the accident, I had injured my arm from doing a cartwheel and was a very physically active person. Now I'm able to resume physical activities. I ride a Harley Davidson. I'm able to play with my daughter on a trampoline and jump and play, and my arms can swing around. I have no problem reaching. I was not able to reach into my cabinets above my head. I would have to get on a step stool and bring one down and catch it. So I was limiting my use of my arm, and today I've almost been totally restored to full use of my arm. I have went through the PRP therapy. I have went through the readjustments and the chiropractic care. I have went through cold laser surgery, which I'm just beginning. However, I was to the point I couldn't shave my armpit. I would shave with my arm down and take a wild guess of if I was getting all the hairs or not. And today I'm actually able to raise my arm and shave. So my arm is fully mobile. And I sleep through the night. I sleep soundly. I wake up, my body's not hurting. And is there anything else you want to ask me?
Yeah, what would you tell someone who is considering doing regenerative therapy and chiropractic care in this office, along with physical therapy and cold laser treatment? What would you recommend or say to someone who's considering treating with our office?
It was a leap of faith for me. I financially didn't think I could afford it. I was able to be accommodated in that area. There are different plans. There's a gold, a silver, and a platinum plan, so you can accept the plan that fits your budget. I was able to work the plan and the treatments around my schedule, so it was convenient for me financially. It was convenient for me on my timeline, and I suggest taking the step for a better you. Invest in your body, invest in yourself. Your health, your body, and your mobility are your responsibility. And a year from now, you'll be glad you started today.
Thank you. I have just one more question for you, Catherine. Thank you so much. On a scale of 1 to 10, prior to coming to our office, 10 being the worst, where was your pain then, and where's your pain now after treatment?
My pain before coming was about an 8 or a 9, primarily when I slept. And if I would overextend my arm during the day, such as lifting or reaching. Today, I rarely have any pain. I have zero pain when I sleep, and I'm still in physical therapy and cold laser, so there are times when I overextend myself. I'm not supposed to go to the gym yet. So it's baby steps, and it is a process, and as long as I follow the suggestions of Dr. Lutz and the office, then I'm able to reach goals that I have set for myself. So my pain today is probably a 2.
Awesome. Beautiful. Thank you so much.
You're welcome. He was doing exercises and readjustments. He had told me my shoulder had been out of line for over a year. And when he readjusted and reset my shoulder, it hurt a lot. I was able to, within 2 hours, start using my arm in ways I hadn't used my arm in over a year. So I would come into the office and tease Dr. Peter that I didn't like him and that he hurt me. But if the truth be told, I am very grateful for him and the experience that I've had with him. And I had to go through a little uncomfortability to get to the other side, but it was well worth it. And yay.
Yes. Awesome. Thank you, Catherine.
Good.
Okay. My name is Robert Napolitano. I've been coming here for, I would say, 3 to 4 months. I traveled approximately 4.5 hours to get here. And I would say that this is probably one of the best decisions I've made in my life. The changes that have occurred in the way my body works from the day I got here to this moment are incredible. The staff, the doctor, everybody, you feel so welcomed. The whole facility is just great, and it's not only about treatment, it's about education. As I'm getting treated, they're educating me, so I know now how to use my body and what to do versus just damaging myself. And it's incredible what they've done here. This place, to me, when I travel here, I'm just so happy. When I leave, I want to dance and sing. This place has truly changed my life as compared to what it was, and not only how my body moves and operates, but also my pain. My pain is gone, and my range of motion, the way my body moves and works, is just phenomenal. I never expected to get the results that I've got from here. This place is like my Garden of Eden. You should come here and make it your Garden of Eden too.
So I've been going to therapy, I've gone to doctors before, and then I came here to Dr. Pete, and I was prescribed to do these exercises that were not easy for me to do. After I did them, here I was challenged to keep doing it every day, and I was determined that I would do whatever it took. Since I've done everything else, I might as well try this too. And honestly, the next day when I did the exercises in the morning, I really was amazed because it did loosen up the tightness in my hips. And then I'm walking to the car, and for one of the first times in several months, I didn't feel the pain that I'm used to feeling. And so I kept it up all week, and I feel much better. Not perfect, but I definitely think I'm on my way.
My name is Haley Murphy. I've been coming to Back in Line for 3 years, and I just signed to play Division I basketball at St. Francis University. And honestly, without Dr. Peter's help, I don't know how my body would be functioning right now, honestly. But he really does help my body to be in the best shape and best form I can.
We're doing active isolation muscle stretching. Active, the patient's going to assist me. It's a thing called reciprocal inhibition. We're going to have the patient flex her quads. Our brain sends a signal to her hamstrings to relax her hamstrings. Some studies have shown that gives you approximately 30% better stretch than if you were just doing what they call static stretch, just pushing the leg back. Isolation, we're going to isolate particular muscles. So in the hamstring, there's 3 heads. Just going back is only stretching out mainly one head. The other 2 heads are getting a slight stretch but not being isolated. We're going to isolate each head individually. Okay? So our starting point is approximately right here, which is about 70 degrees. My goal is to get her to about 90 degrees within just a few seconds, okay? Now, when I push back, you're gonna flex your quad. So flex the quad, and release. And really relax it completely. Flex the quad, and release. Flex the quad, and release. Flex the quad, and release. Flex quad, and release. Now I need to feel that quad flex that whole time. Why I bring leg back to neutral, we're allowing blood to flow back into the leg. Okay, we want to make this as painless as possible. Flex quad. There we go. And release it. And release the quad. Just relax it. Flex it again. Relax it. I said I want to get to 110. We're about 100 degrees right now. We're close to about 95 to 100 degrees. Flex quad. And release. Flex quad again. Flex it real tight. And release. Okay. Now I'm just going to use one finger. See where we're at. I'm just around 90 degrees. I'm just beyond 90 degrees. That's with one finger. I'm satisfied.
Hi, this is Roger DiLorenzo. I've been coming to Back in Line with Dr. Peter for about 5 years now. I actually moved to Panama City, so the last time I came here was a year ago, Thanksgiving, so it's been a year. And he went out of his way to help me today. And, you know, it's a blessing. I can't even say how much he's done for me. And I wish you can experience it like I have. God bless.
If you're watching this video, you're probably among millions of people who needlessly suffer from knee pain, elbow pain, foot pain, peripheral neuropathy, joint pain from arthritis, and many other conditions. Unfortunately, those who suffer from these problems have had virtually no options to relieve or fix these issues. Many people try over-the-counter pain relievers and expensive prescription medicines that do not fix the problem, and may only offer some temporary relief with sometimes devastating side effects. Some people are recommended surgeries that are risky, expensive, painful, and may or may not fix the issue. Even worse, some are told by their doctors that there is nothing that can be done and are left to suffer every day without any good options. The good news is, there is a growing field in healthcare called regenerative medicine. Regenerative medicine has already been responsible in helping hundreds of thousands of patients with these types of conditions and preventing countless numbers of surgeries. Regenerative medicine is the rapidly advancing area of medicine that has the ability, in many cases, to help repair injured and damaged tissue in the body that was not possible before. One of the types of regenerative medicine used in this office is called platelet-rich plasma, or PRP. PRP is a next-generation, non-surgical, minimally invasive treatment that uses the body's own ability to heal, repair, and grow tissue. Your body uses free circulating stem cells within the blood along with growth and healing factors to fix your area of pain or injury. Stem cells and platelet-secreting growth factors are the injury-fixing superheroes of your body. They are called to your area of pain or injury by the plasma that is rich with platelets or PRP. The PRP not only calls the stem cells to the scene, but also gives them extra super healing powers, which speeds up and aids in recovery. Generating PRP is a simple process. A health professional draws a small amount of blood from the patient. It is then put into a centrifuge and spun for a short period of time, and then activated with a special proprietary solution from Juventix. The drawn blood is spun until the plasma inside the vial has 3 to 6 times the number of platelets than normal plasma. The health professional then extracts out the separated PRP and injects it into the affected area. This is how Dr. Michael McMahon, MD, explains the benefits of PRP. PRP concentrates regenerative properties found in the patient's body. The PRP is injected right at the site of the injury. The PRP goes to work, starting the healing process immediately. There is very little risk of the body rejecting the treatment or having side effects or infections, because the entire treatment is using the PRP generated right from the patient's own body. Here is what Dr. Brant Koning, DC, said about the success he had with PRP. The results I got were incredible. I had an injury to my left elbow that I thought was going to need surgery. After the first treatment, my pain was mostly gone. After the second treatment, I realized that I would not need surgery. It has been 4 years since my PRP treatments, and my elbow is still pain-free. Thank you for watching this video. If you or someone you know is tired of dealing with pain or other problems that PRP may help and would like to find a solution, we are happy to offer you a free consultation to see if PRP might be right for you.
There was a study done in the UK where hair loss was the most psychologically devastating event for people. I've actually had patients who haven't left their house because of their hair loss. So when they see their hair regrowing, it's absolutely fantastic. My name is Dr. Joe Greco, and I'm the Medical Director for Hair Restoration for New Life Regenerative Medicine. I grew up in medicine. My father was one of the first doctors in the United States doing hair transplant surgery, and my son is a derm surgeon. We're the only 3-generation family in the world doing hair restoration surgery, so hair is very important to us. Hi Christina, how you doing today?
Good afternoon, Dr. Greco.
What's been going on?
For the past 6 months, I have noticed an increase in the amount of hair that's shedding in my brush and in my shower.
You're shedding?
Yes.
Okay. If I can just do a pull test, and usually if we pull more than 3 to 4 hairs out at one time, it's a positive test. 10 years ago, 7 of 10 people who came to our clinic were males who wanted a hair transplant. Today, 7 out of 10 patients are females who come looking for non-surgical improvement for shedding hair or for thinning hair. We also treat various hair loss diseases like alopecia areata, discoid lupus, lichen planus pilaris. Patients come to our clinic from actually 70 countries and every state in the United States because we have developed patented methods to improve non-surgical hair restoration.
You're going to feel just a little stick, 1, 2, and 3. Perfect.
I've been using regenerative medicine therapies with hair for 10 years. And regenerative medicine is exciting because it is the most versatile and safest therapy today. The growth factors in Restore help improve hair by increasing the amount of new blood circulation to the hair follicle, which will make the follicle bigger. It will help turn on fat cells where the vascular stromal stem cells are to grow hair faster. It will help move the hair that's in the resting phase into the growing phase, which will also help hair to grow faster. With Restore, we can now amplify the results of autologous therapy and increase the effects of regenerative medicine.
Almost done. You doing okay? Perfect. Take the band off. 1, 2, and 3. Christina, I'm just going to take this into the lab.
Proteins from our own platelets can help increase the diameter of the hair shaft by creating new blood circulation, can help improve hair to grow sooner and denser. By adding more proteins from another source, like Restore, we can amplify the effects of the platelet-rich plasma. When we used Restore, we simply combined it with a proprietary method of platelet-rich plasma. Non-surgically, our treatment typically takes 1 hour of office time. We extract your blood, we separate the components of the blood, and we concentrate the platelets that can help regenerate hair. We're extracting the proteins and getting rid of all the other cells. Then we infuse the Restore and the PRP. The processing takes about 30 minutes and the treatment actually takes 5 minutes.
I'm just going to go ahead and wet your head. This is just a little bit of saline.
We're going to start by anesthetizing your scalp. Sharon's going to be using a vibrator. The vibrators kind of distract some of the pain of the injection. How you feeling?
Good, I can't feel anything.
Good. Next, we're going to microneedle. When you create a slight wound in the scalp, it stimulates the stem cells in the hair follicle to want to heal the wound and also sends a signal down to the follicle to go into an early growth phase. And now we'll do the injections of the PRP and the Restore. We go in a grid about a centimeter apart. Even though we just treat the whole top of your head, you're going to get migration of these platelets and growth factors all over your scalp. And that's it.
Perfect.
And we'll massage your scalp. The Restore is very safe. There has never been a adverse reaction, and we're all done. What's really nice is there's no downtime non-surgically. Turn your head to the right. Some people will see an immediate improvement to the character of their hair. It looks shinier, it's brighter, it has more bounce to it. Perfect. We actually have patients whose hair is regenerating and getting darker, going back to their natural color. When patients see successful hair growth, they're ecstatic. It gives them confidence, and there isn't a procedure that makes you look younger than when you restore your hair.
My name is Dan Greenwald. I'm a plastic surgeon, and I graduated with honors from Princeton University. I got my medical degree at Yale. My last fellowship was at Mass General, where I taught in the Harvard system for a year. I came down to Tampa in 1993 to run the plastic surgery program with my mentor, and I've been here ever since. I love the challenge of plastic surgery. I think there's definitely a creative and artistic element to it. All of our tissue ages, and the speed with which it ages is determined by our genetic makeup and environmental factors and things that we do to ourselves and expose ourselves to. Typically what we see with aging is that gravity wins. We lose our tissue elasticity, it begins to fall, and it loses its hydration or fluid status. We see wrinkles, fine wrinkles, coarse wrinkles. Different colors come out. We get funny pigment in our skin, and eventually we look old. I think people want to feel better about themselves. My approach to this has been to discuss the limitation of distractions. If you look in the mirror or take a picture and there's a part of you that's distracting every time you see yourself, we can adjust that distraction. Regenerative medicine is an endeavor to affect the aging process by changing our body's biochemical response to different factors. Regenerative medicine is exciting because it allows us to reverse the effects of aging and degeneration that are inevitable in the human population. What's great about it is not only can we look better and feel better, but we can improve our quality of life. What we've discovered in the past 20 years is that there are molecules, biochemical processes that favor regrowth of normal tissue as opposed to the creation of scar tissue or tissue that is subnormal. And what regenerative medicine does is it harvests these molecules and forces our body's metabolism into a regenerative and restorative process as opposed to one of degeneration, aging, and scarring. Restore is a bunch of molecules that we've isolated that favor a regenerative process as opposed to a degenerative process. These molecules are what help healing without scar formation. And once these molecules are present in our tissues are driven towards restoring to normal that which has degenerated because of age or trauma. This is an evolving technology, and we are just now scratching the surface. What we have found is that when we mix Restore with other molecules, things that we use, let's say as facial fillers, these fillers last a lot longer and promote better growth of healthy tissue. Restore is actually a concentrate of the important molecules that are directing the cells to do what we want them to do, which is create new, healthy, youthful tissue. This molecule in the deep dermis and in the tissue planes where the skin is constantly being made promote the regeneration of normal, healthy tissue as opposed to the aging skin that we all make as we get older. The molecules go to work almost immediately, prolonging the effects of fillers and starting a process of regeneration from day one. I believe that this will take a result that would normally last up to 1.5 years and cause it to last for years. All of the processes in our body are driven by cellular environment, chemicals and soup that we all have circulating within us. The Restore molecules are a directing soup that tell our cells, hey, don't make scar tissue, make something new, make something fresh, make something like it was made 20 years ago. So these molecules direct the normal processes in our body towards a more restorative endpoint as opposed to just scar tissue and aging. In most cases, this will last anywhere from 7 to 15 months. I think with Restore, it's going to last years and years. This is something that I very much believe in because it's based on a long history of very good science. This is a remarkable advance.